Hello, and welcome to PCLP's Site Supervisor Orientation. The objectives of this orientation video are twofold. First, we'll provide a general overview of the PCLP program, including its mission, goals, and objectives. Second, we'll review Site Supervisor roles, responsibilities, and timelines. This information is also provided in the Site Supervisor Handbook you received via email. In 2012, the GE Foundation partnered with National Medical Fellowships to address both the primary care shortage and inequities in the healthcare system, which include not only disparities in health outcomes, but also the underrepresentation of minorities and lower-income students in medicine and in graduate nursing and physician assistant programs. The mission of PCLP is to address the primary care shortage and healthcare system inequities simultaneously by placing underrepresented students at community health centers nationwide for primary care service learning experiences. Scholars gain valuable experience as part of primary care delivery teams for the medically underserved. This nurtures for many their passion to give back to communities in need. PCLP thus pursues, in one single step, two mutually reinforcing components of our mission: building capacity at community health centers, and developing the pipeline of future primary care practitioners. And it's working. To date, PCLP scholars have contributed more than 51,000 service hours and 256 capacity-building service learning projects at our partner CHCs. And 83% of scholars who have graduated from their academic programs have entered primary care practice or chosen primary care as their specialty. We attribute PCLP's success to our ability to accomplish four key goals in partnership with PCLP site supervisors, faculty advisors, and other stakeholders. Inspiring scholars to serve the medically underserved by giving them the experience of serving in those communities. Providing an engaging primary care leadership training program and cultivating scholar skills in data-driven project management via the team-based PCLP project. Enhancing scholars' clinical skills through clinical rotations, and building a national network of mentoring support for scholars by introducing them to CHC providers, university faculty, and other healthcare leaders. Here's where the PCLP network exists this year. We're placing 55 medical scholars and 5 graduate nursing scholars in 11 cities coast to coast. The Site Supervisor Handbook has a complete listing of PCLP cities, along with our site partners, faculty advisors, and scholars in each city. PCLP site partners are critical stakeholders who provide the foundation upon which the PCLP experience is built. As placement sites for PCLP scholars, site partners assign each scholar a site supervisor who develops and implements a site-specific PCLP program. We have two main objectives for PCLP site supervisors. The first is to provide scholars a rigorous and engaging service learning experience that incorporates 3 components: leadership training, PCLP projects, and clinical rotations. A word about leadership training. Site supervisors promote this activity by assisting scholars in scheduling interviews with site leaders, such as the CEO of the organization and board members. We also ask that you allow scholars to participate in all PCLP leadership seminars scheduled during their on-site period. The seminars will be conducted via webinar on 2 Friday afternoons, June 17th and 24th, between 1 o'clock and 3 o'clock Eastern Time. Our second objective for site supervisors is to provide professional mentoring to scholars interested in primary care. These scholars share your passion for serving medically underserved communities. The time you spend discussing your experiences and their goals and desires has a tremendous impact on them. Site supervisors often seek clarification of the division of labor among those involved in mentoring and supporting PCLP scholars. PCLP staff handle all administrative aspects of the program and are also here to support all stakeholders throughout the program season. We conduct the leadership training course and host program events such as the PCLP Symposium to be held in July. PCLP site supervisors are the scholars' primary supervisors as they supervise and monitor scholars' daily activities on site. Site supervisors also determine projects to be conducted at their sites. PCLP faculty advisors bring valuable academic support to PCLP by supporting sites in scoping out feasible team-based PCLP projects, serving as scholars' project advisors, and providing professional and academic mentoring to scholars. Now let's look at the site supervisor role more closely. Before scholars arrive, site supervisors develop a site-specific program and schedule for scholars. This includes identifying a list of potential PCLP project topics for scholars, determining how the clinical component will be structured and executed on site, and developing a general program schedule that outlines how the scholars' time will be spent on site, including making provision for scholars to participate in Friday PCLP webinars, that is, the PCLP Leadership Seminar and a series of professional development seminars hosted by the GE Foundation. These will be held most Fridays between 1 o'clock and 3 o'clock Eastern Daylight Time. Supervisors also complete site planning forms which specify key site partner contacts, collaborate with PCLP faculty advisors to scope and refine projects, complete a Memorandum of Understanding, Form W-9, and the online GE NMF PCLP grant proposal which outlines the site's program, provide a list to NMF staff of human resources documentation and paperwork required before scholars arrive on site, and make first contact with scholars in April or May. During scholars on-site period, the first task of site supervisors is to clearly designate a program coordinator to advise scholars on all aspects of program administration. Ideally, during the first week, you will also conduct an in-house orientation to acclimate scholars to your organization and to introduce them to integral staff on site. Please also distribute immediately the identification badges that we will ship to you before scholars arrive. Finally, in week 1, we ask you to review and approve your scholars' project proposals. Their proposal form, which you can find in the handbook, is similar to the project scoping form, but it allows scholars to specify their activities and timelines in more detail. From then on, you'll meet with your scholars once weekly to monitor their progress and help them schedule their leadership interviews. In a moment, I'll discuss what your focus might be for each weekly meeting. Site supervisors also assist scholars in arranging 3 required interviews with site leaders, including the CEO, chair of the board of directors, and 1 additional site leader chosen by the scholar. At least one of these leaders must be a clinician leader. Finally, site supervisors must verify scholars' completion of their 200-hour service requirement by signing scholars' timesheets at the end of the service learning period. Here's a sketch of a meeting plan from pre-arrival through week 6 of the scholar's time on site. In April and May, it would be great to introduce yourself to your scholars and learn something about them, including what PCLP projects interest them and why. They'll receive project information in May after we collect project scoping forms from sites and faculty advisors. In week 1, you should meet with scholars to review and approve their project proposals. Their proposals are due at the end of week 1. The focus of weeks 2 through 4 should be ISL project progress. Have projects launched successfully? Are data collection and other activities progressing on schedule? In week 3, please ensure scholars have scheduled their second leadership interview and assist them in scheduling their third. In weeks 5 and 6, your meeting should focus on your scholars' ISL presentations to sites. In week 5, please make sure all scholars have scheduled their third leadership interview. Of course, you may find it prudent to discuss topics at different points on the timeline. That's perfectly fine. This is just a guide. After your scholars' service learning period, PCLP program evaluation begins in August. All site supervisors must complete the evaluation survey. You may also be invited for an interview to discuss your site's experience with PCLP in greater detail. Here's a timeline of site supervisor activities. 3 additional items are worth noting. On May 31st, PCLP will host our annual kickoff, which launches our season with reflections on our mission and the importance of primary care leadership. Featured speakers include National Advisory Committee members, including our chair, Dr. Jack Geiger. Secondly, we'll bring all 60 scholars together for our first annual PCLP Symposium to be held July 10th and 11th in Chicago. Our purpose? To inspire, amplify, educate, and celebrate. Sessions will focus on primary care leadership and professional skill development, and a select number of scholars will be invited to present their PCLP projects before a distinguished reactor panel in a special session. Throughout the symposium, scholars will network with a range of primary care leaders, PCLP stakeholders, and National Medical Fellowships alumni. Finally, grant payments will be disbursed beginning in May, following your submission of your site's grant proposal and Form W-9. Both documents must be received by NMF before payments can be initiated. Before we end, we thought we'd share what scholars report as being the qualities of site supervisors most conducive to their success. Conversely, when these qualities are missing, scholars report dissatisfaction with their experience. The most important quality is availability or accessibility. Scholars greatly value supervisors' commitment to their weekly meetings and prompt responses to their calls and emails. Scholars also value the knowledge you share with them, especially about your profession, your leadership experiences, and important issues in primary care. Not surprisingly, scholars also express appreciation of your supportiveness, your attentiveness to their interests and insights. Finally, we want to remind you of resources at your disposal. The Site Partner Handbook provides comprehensive information about the PCLP program. The PCLP website provides additional helpful resources, including a resource library of past ISL projects. PCLP staff are also resources for you at any time. As always, the GE Foundation and National Medical Fellowships thank you for your commitment to mentoring these outstanding future primary care leaders. We very much look forward to working with you this summer.